Dr. Ron, unfiltered, uncensored, is for people who are tired of being misled, over-medicated, and dismissed by the sick care system. Dr. Ron, unfiltered, uncensored, stands as the fearless voice of clarity and empowerment. Unlike sanitized health media or corporate-aligned medical messaging, Dr. Ron delivers bold, evidence-informed insights that cut through confusion and restore personal agency. His mission is simple and radical. Give people the truth, give them tools, and give them back control of their health.
Yo, doctor's in town. Oh yeah, the doctor's in the house, y'all. He's in the house, man. Listen to this, man. He got some good news for you. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house.
Hey, ladies and gentlemen, the doctor is in the house. Welcome, everyone, to episode 11 of Dr. Ron, Unfiltered, Uncensored. Episode 11 as regarding the Dr. Ron Doctrine, but over 650 episodes on our webpage at podbean.com, docronradio.podbean.com. I sort of separated these out, as you know, because I laid down the Dr. Ron Doctrine in the first 10 episodes, and now we're here at 11, and I had to do this one today because there was a recent article in the paper about the CKM syndrome, and I want to show you how everyday events in medicine can be applied and thought about through the Dr. Ron syndrome. And just to read this, the 2026 guidelines that came out June 29th of 2026 for the American Heart Association, American College of Cardiology, etc., explains this CKM syndrome, which is Cardiovascular Kidney Metabolic syndrome. We'll get into this during the episode. They explain it as an interconnected condition involving metabolic risk, kidney disease, and cardiovascular disease. And they recommend staging and earlier intervention. And that's important because we have been talking about earlier intervention upstream. But is this upstream enough? Medicine has connected these organs now, cardiovascular, kidney, and metabolic. Now the doctrine asks, what connects the biology? Has medicine gone far enough? So welcome back, everybody, and welcome back to something new. So let's summarize the first 10 episodes of the Dr. Ron Doctrine. We talked about the framework about inflammation, cellular resilience, mitochondria, membranes. We talked about food as biological information. We talked about cholesterol. And we talked about one of the biggest problems in modern medicine. We have become very good at treating pieces of the human body. But you know what? Sometimes we lose sight of the whole person. So now we're into what I'm calling phase 2. We talked about and outlined the doctrine. Now we have to apply it. And phase 2 is going to be different because here we take the doctrine off the classroom blackboard and now we put it on the examining table. And we're going to apply the doctrine today to something that is happening in medicine right now. And I said this article was just published this week in the newspaper. Its name is Cardiovascular Kidney Metabolic Syndrome, CKM. And here's why I think this is important. Medicine has finally begun connecting the dots. But my question today, as I have said, is, has medicine gone far enough upstream? Is this a new syndrome or is it an old one that's finally being recognized? The American Heart Association, American College of Cardiology, the American Diabetes Association, the American Society of Nephrology have now issued the first major clinical guideline specifically addressing this CKM syndrome. It's important because the guideline recognizes something that many clinicians have known for years. Heart disease does not exist in isolation. Kidney disease does not exist in isolation, nor does diabetes, nor does obesity, nor does metabolic dysfunction exist in isolation. These conditions interact, they influence one another, they can accelerate one another, and they can eventually produce what we recognize as cardiovascular disease. The guideline establishes stages for this syndrome and emphasizes earlier identification, risk management, prevention, and coordinated care. That's progress. And I want to acknowledge that because this is not about attacking conventional medicine. When medicine moves toward a more integrated understanding of the patient, we should applaud it. But now comes the Dr. Ron question. The patient doesn't have 4 bodies. That's the way medicine is organized. You have a cardiologist, they look at your heart. You go to a nephrologist, they look at your kidneys. You go to an endocrinologist, they look at your metabolism. You go to another specialist, they look at something else. Each specialist may be absolutely correct about the organ they are examining. They may be absolutely correct in their specialty. But here's the problem. There's no patient that I know that has 4 bodies. Patient has 1 body. And the heart, kidneys, liver, pancreas, blood vessels, muscles, and brain are not independent departments. Hello, they communicate. They share circulation. They share hormones. They share inflammatory signals. They share metabolic signals. They are all dependent upon the same cellular environment. And that's why CKM syndrome interests me when I saw the headline, because medicine is finally beginning to say, hey, maybe these are not separate diseases. Maybe they are connected. And that's where the doctrine begins. So let's run through it. Let's make this real. Imagine, let's take a patient, 62-year-old. The patient's carrying around some extra abdominal weight. They have some elevated blood pressure. Their triglycerides are elevated. Their HDL, the so-called good cholesterol, is low. Their sugar, their blood glucose is creeping up. The patient has developed insulin resistance. Kidney function isn't what it used to be. Cholesterol is elevated. And here is what traditionally would happen. We create some diagnoses: hypertension, dyslipidemia, a good one for hypercholesterolemia, prediabetes, obesity, chronic kidney disease, and maybe we'll throw in cardiovascular disease, separate diseases. Then we create a treatment plan for each of these diagnoses. And I'm not saying they're wrong. Some may be absolutely necessary. But the doctrine asks a different question. What happened before these diagnoses were made? What changed that patient's biology? What created the environment in which all of these systems began to deteriorate? So this would be upstream. This is before you arrive at a diagnosis, before you develop the symptoms that created a diagnosis. So we don't start with the disease. This is a fundamental principle of the Dr. Ron doctrine. Don't start with the disease. Start with the biology. The disease is the endpoint. It is something we can name. Is what the AMA can give you a code for so you can bill for it. But disease does not appear out of nowhere. There is usually a trajectory. There is usually a progression. There is a biological story that preceded the diagnosis. And that's where I want us to look. What happened to the cell? What happened to energy production? What happened to the body talking to itself called signaling? What happened to the membrane? What happened to inflammation? What happened to the metabolic environment? And what happen to the ability of the body to maintain homeostasis? That is, keep everything working properly. See, that's now you're thinking like the doctrine. And this brings us right back to one of the most important lessons in our first 10 episodes. Remember the cholesterol firefighter? When we see cholesterol elevated, the temptation is to assume that the cholesterol is the villain. But think about the firefighter. If you see a firefighter outside of a burning building, do you automatically conclude that the firefighter started the fire? Of course not. The firefighter, what? They're responding to what? They're responding to something. Now, I'm not saying cholesterol is harmless. I'm not saying that LDL doesn't matter. But what I am saying is a laboratory number is not necessarily the beginning of the story. That patient may have high glucose, high blood pressure, high triglycerides, excess body fat, visceral fat, insulin resistance. They may have inflammation, kidney dysfunction, other abnormal lipids. And the question is not simply which number do we lower? The question is, why are all these numbers moving in the wrong direction at the same time? That is the more interesting medical question, the one that we have to answer. Don't treat each of those abnormal symptoms individually. Now, here CKM's, the cardiovascular kidney metabolic syndrome, gets it right. Let's give them some credit for that, because this is actually a significant development. The new guideline doesn't simply say treat the heart disease. No, it emphasizes identifying risk earlier. It recognizes stages. It incorporates cardiovascular, metabolic, and kidney risk all in one. It calls for coordinated care. And it recognizes that progression can potentially be slowed or reversed through intervention. That is exactly the direction prevention should be going. We should not wait until the patient has a heart attack. We should not wait until the patient has advanced kidney disease. We should not wait until diabetes is fully established. We should not intervene while the trajectory, we should intervene. We should intervene, however, while the trajectory of the disease is, the trajectory of the problem is still modifiable. That's good medicine. But here's where I believe the doctrine takes us one step further. Let's take a look at this. We already covered this here, one patient, one body, not 5 diseases. Let's hear how we can connect the biology. Connecting the organs is not the same as connecting biology. So the syndrome CKM tells us what? Heart, kidney, metabolism, they're connected. That's what medicine is telling us. They're connected. But what does the doctrine say? The doctrine says and asks, okay, but what connects them? So the next question is, and this is where we begin to talk about the common biological environment: chronic metabolic stress, inflammation signaling, oxidative stress, poor quality nutrition, physical inactivity, disrupted poor sleep habits, environmental exposures to toxins, stress on our mitochondria, stress on our membranes. We talked about this with adulterated parent essential or adulterated fatty acids, the loss of the resistance of our cells, the failure to adapt. So I'm not suggesting that every case of CKM syndrome has one single cause, because biology is more complicated than that. But what I am suggesting is that the body may respond to many different insults through overlapping pathways of dysfunction. And inflammation is one of them. Cellular energy failure can be another. Impaired signaling can be another. Loss of metabolic flexibility can be another. The organ may be where we finally see the problem, but the problem may have started much earlier. Did we go back far enough? So we need the doctrine to connect the biology. The disease is the endpoint, but the story is in the biology. So another doctrine principle is that food is information. We spent decades asking how many calories, how much fat, carbs, protein. But biology doesn't ask that question. Biology asks different questions. What signals does the food deliver? What happens to insulin, glucose? What happens in your gut? What happens to inflammation? What happens to the cell membrane? What happens to the mitochondria? What happens when the same dietary pattern is repeated for 10, 20, or 30 years? That's a little different way of looking at nutrition, not as the diet of the day, the fad diet of the day. And you know why I bring it up? Because it's relevant to this CKM syndrome because the guideline itself places considerable emphasis on lifestyle, nutrition, physical activity, and weight management in addition to the medical treatment. The doctrine simply says, don't reduce nutrition to calories. Do not reduce nutrition to simply talking about calories. Ask what the food is telling the cell. Every episode of the first 10 episodes applies to this doctrine. Now we go to the mitochondria. Every cell needs energy. We need energy. People have fatigue all the time. But is it at the beginning of the trajectory? The heart needs enormous amounts of energy. The kidneys need enormous amounts of energy. So does the liver, and so does our brain. Our muscles also need energy. These organs do not operate independently of energy, that energy from the cell. So when we talk about cardiovascular disease, kidney disease, and metabolic disease, that CKM syndrome, I don't want us to forget that the machinery inside the cell has to do with this. That machinery is the mitochondria. The mitochondria the mitochondrial function becomes impaired if the oxidative stress increases, if cellular signaling becomes distorted, if the membrane environment changes. In other words, if that membrane gets coated with adulterated fatty acids, then the cell may become less resilient. And that's an important word, resilience. The doctrine isn't promising that we can eliminate disease. It's asking the question, can we create a biological environment in which the body is better able to maintain function? We don't want to treat each symptom individually. We want to treat the whole environment, the cells, the membranes, the mitochondria, toxins, so that the body can maintain function. So how does that affect the person that we're examining right now? So you maybe say, hey, Dr. Ron, you're saying I shouldn't take my blood pressure medicine? Absolutely not. No, that's not what I'm saying. If you have hypertension, hypertension deserves appropriate treatment. If you have diabetes, you should be receiving appropriate treatment. If you have kidney disease, you deserve appropriate management, as it goes also with cardiovascular disease. The doctrine is not medicine versus lifestyle. It is not drugs versus supplement. It is not conventional medicine versus alternative medicine, but it is treatment and restoration. Treat the immediate problem, but don't stop asking why the problem developed. What was upstream of the problem? Where did the trajectory toward this problem start? Control the blood pressure, but ask why blood pressure became abnormal. Control the sugar, the glucose, but ask why glucose regulation deteriorated. Manage the heart, but ask what produced the environment that created this risk. And that's what going upstream means. I hope you understand that. Just a personal message. I have a friend with atrial fibrillation, really smart person, takes the appropriate vitamins, knows about energy healing, but lost track of himself by giving himself to his patients. And long story short, he went into heart failure. This person required pharmaceutical drugs. It could not be controlled with celery and garlic and what have you that you can use to maintain a problem. He needed drugs. So that's why I said if you need treatment, yes. Now, now once the atrial fibrillation is corrected, the heart failure is corrected, then the doctrine comes in and you start asking the questions of what happened and how can we restore the body. This is what phase 2 means. So let me make this clear. The first 10 episodes were about constructing the doctrine, building the foundation. Now we test it. That means something is going to change. From this point forward, I want to take real medical stories, real studies, real discoveries, real patients, and put them through the doctrine. Not what Dr. Ron believes, but let's take what medicine is telling us and see what happens when we look at it through the doctrine. I hope that will be more interesting for you because we will always be looking upstream because sometimes the doctrine and conventional medicine agree, and sometimes they may disagree. And sometimes conventional medicine may have answered one question while the doctrine asks the next question. That's where the intellectual fun begins. We're going to have fun with this. And CKM is the first perfect test for me. CKM syndrome gives us the perfect starting point. Medicine is saying these conditions are connected. Yes, I agree. Medicine is saying we need to identify risk earlier. I agree. Medicine is asking lifestyle matters. Definitely agree. Medicine is saying we should coordinate care rather than operate entirely in silos. Well, medicine is saying that, and I agree. We are more than the sum of our parts. But then the doctrine asks, what creates the biological environment in which all of these diseases flourish? And that's the question I want to pursue, because if we can identify those upstream influences earlier, perhaps we don't simply manage the consequences. Perhaps we have an opportunity to change the trajectory. And that is the essence of prevention. So let's wrap this up. It's taking long. I'm going to just give you my personal take on the CKM syndrome. CKM syndrome is progress. It's an important acknowledgement that the heart, kidneys, and metabolic system don't operate in isolation. But I believe it's only the beginning. Medicine has connected the dots between the organs. The Dr. Ron Doctrine asks us to connect the dots at the cellular level, upstream. And that brings us back to the fundamental question we've been asking since episode 1. What if the disease isn't the beginning of the story? What if it's the end of the story that started years earlier? What if prevention means identifying that story while we still have time to change it so you never get to the diagnosis? And what if the most important question we can ask isn't what disease do you have, but how about if we ask what happened to your biology? That's phase 2 of this program. We're going upstream. Once you get a disease, you have been sick for a while. You have a diagnosis. Once you have a diagnosis, that tells you have been sick for a while, and this is the end point. We want to go upstream to that to try and prevent you from having a diagnosis in the first place. So most of you have been with me for the first 10 episodes, and I thank you with an attitude of gratitude. You've helped build the doctrine, and now we're going to use it. I'm going to promise you this. I'm not going to limit phase 2 to textbooks or medical journals. We're going to look at what's happening here and now. And if I have permission from my friend, I'll have him on the program to tell you what happened, why a person so intelligent missed out that he was in heart failure or had atrial fibrillation. Because medicine, dear friends, is changing. technology is changing. Our environment is changing. Our food is changing. And our understanding of disease is changing. The question is whether we are willing to change the way we think about health. Are we willing to change the way we think about health? Or do we have a dissonance problem? So, ladies and gentlemen, I'm Dr. Ron. This is the Dr. Ron Doctrine. And in phase 2, we're going upstream. We are going upstream. And that's what the last part of that slide shows. The Dr. Ron take is we're going upstream. And I'm not going to overload you with treatment recommendations. We can address those at another time. But right now, we want to establish that the doctrine is there to identify symptoms which are upstream of a diagnosis, maybe a brain fog problem or just not feeling right, when all your blood tests are still normal. So I hope you understand that and where we're going from there. So, a couple things. The audio podcast is on docronradio.podbean. That's podbean.com. At that address, you'll see all 650 some episodes. docronradio.podbean.com. And then for the past, 7 months or so, I have been writing and producing podcasts on docronradio.substack.com. And there you'll see my writings and you'll see this video. And you can follow me there, no charge. Just subscribe. And if you like what you hear, please share it. And this podcast is available on any place that you get your podcasts, Spotify, Apple, whatever. Just about any place, even Google and Alexa. So thank you. And this was a little long, maybe a little complicated, but we will continue to apply the doctrine to diseases, either from real life patients or real life stories. So with that, thank you again, and I'll have Freddie take us.
Hey everybody, Dr. Ron's finished for today. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. And let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house.